Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Today, we are continuing our series on women in sports with a focus today on nutrition and what it means to properly fuel your body. And instead of guessing how many calories you need, we'll show you this contraption that can provide specific data for a good nutritional plan. But first, let's get to our morning rounds. We are just 6 days away from the biggest event in the solar system. Millions of Americans will see the moon eclipse the sun on Monday, just like it did in this video back in 2017. Kansas City is not in the path of totality this time, but it will definitely get dark in the early afternoon. And while it's an incredible sight, you do need to take precautions when it comes to your eyesight. We are talking this morning with Dr. Julie Quick, an ophthalmologist at the University of Kansas Health System. Dr. Quick, good morning. And we are happy to share that in 2017, our health system didn't see any cases of eye damage related to the eclipse. And that is thanks to this flood of eclipse glasses that we see people wear. How does someone know if the glasses that they get their hands on are good enough to stare up at the sky?
Yeah, good morning. Thanks for having me. So when you're buying eclipse glasses, you want to make sure that they are ISO certified and compliant. So to make sure that they meet those standards, you can actually look at the side of the glasses, can't see them right now, but it will say ISO 12312-2. The problem is sometimes people will steal the logo and put it on the glasses. So to make sure that you're getting them from the right vendors, you can go to the American Astronomical Society's website and look at the different vendors. Also, kind of a clue if you don't have the right kind of glasses is if you look through them and they still look like sunglasses, that would not be right. It should actually almost look like it's completely black when you're looking through them.
Okay, good tip to know there. Where can we find the good ones?
Yeah, so I was just looking at the website last night, and you can actually get them from some pretty big vendors like Walmart, Warby Parker, Lowe's, and our clinic, KUI, we are actually selling eclipse glasses for $5. That may seem a little bit more expensive than other vendors. However, it is for a good cause. It's to benefit the KUI Lions Vision Clinics, which provides free vision services for those in financial hardship and without insurance.
Well, let's pretend we can't find any of these eclipse glasses or get out and buy any. What are the alternatives? Are there any?
Yeah, so I mean, you can never, never want to directly look at the sun, but you can indirectly look at the sun. So to do that, you would make what's called a pinhole projector. So to do that, you make a hole in like a cardstock or cardboard. You can put it up to the eclipse, and then you'll shining down on like the concrete or like a white piece of paper, you can see the eclipse shape.
Okay, so what is the risk if someone ignores or forgets this advice they're hearing this morning and glances at the sun, even just for a moment?
Yeah, so even just for a moment, you can get what's called solar retinopathy, which is what happens when the bright sun rays hit the back of your eye, the retina, and it can damage the fovea, which is what gives you fine detail and color. So people can have blurry vision, they can see after images, they can have color distortions. Sometimes people recover, and then sometimes people don't. So just not worth it.
Have you seen patients in the past who've had eye damage from looking at the sun?
Yes, I have seen patients that have had it, and one guy, he, was a teenager and was with a bunch of his friends, and they thought it would be, cool to look at the solar eclipse, and so now has permanent damage to the retina and kind of just sees an outline of the eclipse in the center of his vision.
Oh, okay. Well, that just hit home. Okay, so we're not joking around when we say get the glasses, get the glasses, or just stay inside if you can't do it right. All right, Dr. Quick, thanks so much. Great information.
Absolutely. Thanks for having me.
Thank you. Well, turning now to women in sports, we welcome back Dr. Lisa Vopot here in the center seat, a sports medicine specialist who created and leads the female athlete program at the University of Kansas Health System. A crucial part of the female athlete program is diet and nutrition, which is why we are talking this morning with Sarah Arnold. Sarah is both a sports performance dietitian and also a certified personal trainer. So great to have you both here. Great to have you back. Lots to talk about. So, and in just a few moments, we're going to visit visit our Sports Medicine and Performance Center, where physical therapist Allie Thompson will show us one specific area of the body that all women should keep strong and stable. So she'll have some good tips for us, so stay tuned for that. But let's start with what doctors say is the best way to measure your metabolism. Here's what it looked like when I met with Sarah for a resting metabolic rate test.
Hey Sarah. Hey Jessica, I'll have you sit down on this physical therapy bed here. We're gonna do your resting metabolic rate test. So what that will entail is I will put an astronaut looking hood over your head with a large area of plastic wrap. Your resting metabolic rate is going to be directly related to your oxygen consumption. So the idea of tucking that in tight is to prevent any air from the outside environment coming in and prevent any air escaping.
Am I gonna fall asleep?
You will not fall asleep because you cannot. You will keep your eyes open, and then just try to limit talking because that can alter your breath rate as well.
Okay.
So we'll go ahead and do that.
Okay, let's do it. Do I lay down?
Yep, go ahead and lay down. You can put your head on that pillow, just lay comfortably.
Oh, I like that. Okay.
All right, the hood's going on.
Okay.
I'm gonna hook you up to this tube and just turn on our pump so it starts filtering your
Yes,
air.
please turn that on. Okay.
All right, lifting your arm up, we're just gonna tuck this plastic wrap.
Okay.
All right, Jessica, we're done. I'm gonna pull this off you. And you can sit up whenever you're ready.
This is what I look like when I get up in the morning. It really is. Just about an hour and a half ago. So I did the easy part, Sarah. I just laid there, I breathed. You told me to not talk a lot. I kind of followed directions. But you were doing the hard part because you were looking at the screen and deciphering what all these numbers are going to ultimately end up meaning. But what were you looking at? What were you measuring?
Yeah, as you saw, there is a lot that kind of goes on during that test, but really all that we're looking at is the rate at which you consume oxygen, so your oxygen consumption, and that directly translates essentially into how many calories that you burn in a day, solely at rest. So that's why you can't fall asleep, because your resting metabolic rate is different when you're sleeping, and then talking can alter that breath rate as well. So that's why I gave you those instructions.
So you go through this test. What are you going to use that data for?
Yeah, it is super helpful data to have, particularly in the athletic population. Generally, we are taught these predictive equations that are really based on sedentary older people. I would assume primarily a male population as well. And so it doesn't always translate perfectly into the athletic population. We know that those athletes can have different factors that may alter their resting metabolic rate. So this contraption, like we called it, essentially helps us rule out any of those factors that we're missing with those predictive equation, and gives me a black and white number of, hey, this is how many calories that you are utilizing at rest, essentially just to exist, right? And that can be helpful information for people to have, because oftentimes it's a lot higher than they think that it would be.
Well, and you were telling me when I got finished that it all computes, but you said you're the human factor, where you're taking in the questions that you ask, and you're finding out what my lifestyle is like, and how many calories I'm burning, and what's coming in and out. So, so you're not just looking at the numbers, because not everybody's created equally. And when we think of metabolic rate or metabolism, it's kind of like a supply and demand. So what happens when the supply doesn't quite meet the demand, Dr. Vopat?
Yeah, so people can actually have either an acute or a chronic. So either a short period of time or a long period of time live in an energy deficit. So an energy deficit is essentially when you're not taking in enough fuel to account for all of the activities that you're doing throughout the day. And if so, your body over time will actually compensate. So if you hit a certain threshold where you're not getting in enough fuel to meet your body's baseline physiologic needs just to think and, pump your heart and have your lungs breathe, then the body is going to adapt. It's going to realize it's in starvation mode, and it's going to slow down every physiologic process in the body. So there's really not a system that's not affected by that, but it can be really individual on what systems are affected.
We were talking this morning, we all think of that that magic 2,000 calorie diet number that I've had in my head all my life. And then when I want to lose weight, I always knock a few hundred calories off. Now I'm like, okay, maybe I'll just take in 16 or 1,700. I have zero idea why I'm thinking that. I just thought of that in my head. But give us kind of a little math equation, Sarah, about how much 16 calories really is, because it's not much. 2,000 isn't much either for some people, as far as even just before you even lift a finger, kind of like what you were saying. But help us understand what that really means.
Yeah, and just because you called it a magic number, it's really not a magic number, but we place all these values in these numbers that we're seeing on social media or a Netflix documentary, kind of like we were talking about. But really the reality of it is oftentimes, particularly in the female athletes that we're working with, and especially in those that are growing and developing, I mean, I rarely only give my athletes that I work with, and even those that are more sedentary but still recreationally active, I rarely only give them 2,000 calories, right? Just a couple weeks ago, a male that I did a resting metabolic rate test on, his was 2,200, meaning that his body needs 2,200 calories just to exist. And he's also building a fence and working out in his basement and taking walks on lunch. And so that significantly increases the amount of fuel that his body needs. And we utilize activity factors to sort of relate to how active that person is, which is going to be very, very individualized. And I always recommend that people talk with someone that could help them figure out truly how much fuel their body needs. And this resting metabolic rate test can be a good place to start.
Yeah, because just historically, females, we have that calorie counter kind of going off in our head. How much do women, in general, female athletes, underestimate their calorie intake?
I would say most underestimate their calorie intake, really. If I were to place a percentage on it, I almost want to be aggressive and say 90%, truly. I think that you're onto something that we just naturally feel like we do need to kind of watch what we eat or be aware of how much we're taking in, but that's really not appropriate in a population that is growing in terms of the adolescent population, competing at an elite level and doing multiple hours of activity in a day. It's not uncommon that, you know, I evaluate a female and they're only consuming 35, 50% of their intake. Now, not all of the time, of course, I have females that are fueling their body, but it's not uncommon that they're under fueling by that much.
Well, Dr. Vopat, we talked yesterday about the increasing awareness of body positivity, so women are getting more comfortable taking in the appropriate amount of calories. Do you see that kind of inching its way forward?
Yeah, I mean, that's a message that we're trying to send, right? You need to fuel your body. So many females underfuel. I see it all the time too, and it can be both intentional and unintentional, where they just don't really understand what their body needs.
There's like a science behind it.
Yeah.
That's why you two exist, to help us get there. But let's talk, we talked a little bit about mental health yesterday. How does this deficiency in our nutrition affect our mental health?
Well, it depends on the level of deficiency and sort of the chicken or the egg argument. But I can tell you from a pure biologic standpoint, a starved brain knows when it's starved. And there's some really good studies out there that show that if you're underfueling your body, you're going to have a higher risk of depression, anxiety, and your mood is going to be severely affected. And then when you refuel and you feed your brain, all of those symptoms can improve as well.
So give us just a general idea, number-wise, just the difference between metabolism and metabolic rate from a pretty active athlete to just the regular person just getting up and doing life?
That's a good question. Typically we do see a difference, and primarily one of the reasons for that is just because of the body composition differences in athletes versus sedentary people, or people who are more recreationally active. Muscle mass consumes more oxygen at rest, making their metabolic rates higher if they do possess a higher muscle mass profile, which again, for someone who's participating in hours of training or is strength training and of course fueling properly, I mean, we can see upwards of 400 calorie differences at rest, easy between females in particular. So there's certainly a difference, and I think that's why it's important to account for that whenever we are working with athletes, and primarily female athletes, who we do want them to have a menstrual cycle and have optimal bone health and all of those things, to make sure that they are not in that 400 calorie deficit, right, that we may get if we just simply use those predictive equations.
Dr. Vopat, you create the female athlete program, and you said you were trying to figure out if there was a way that we could manipulate the word athlete, because when we think of athlete, we're thinking of the female basketball players we watched last night, and you know, when we see these women just doing really big, amazing things. But athlete is what you said. What did you call it? You said
anyone that does physical activity on purpose.
Okay, so and that can mean a whole lot of things. So tell us just your definition of athlete, and what does that really mean?
Yeah, so we run a female athlete program, but I really want to hit home that athlete is really a definition that someone puts on themselves and a self-identity. So if you call up and you want to be part of the program because you identify as an athlete or an exerciser or someone where being active every single day is important to you and your lifestyle, then that's what we do. You don't have to be a formal athlete in organized sport. You can be just a regular exerciser every single day, but if that's important to you, then that's what we specialize in.
So anyone can get this done at the Performance Center, correct?
Absolutely, yeah.
All right, well, let's turn from diet and exercise and visit with physical therapist Allie Thompson, who is out at the Sports Performance Center in Overland Park. If someone wants to get active again, but let's say they haven't worked out in a couple of months or two, or a year or two, Allie, what's the best way to start exercising again?
Hi, Jess. Thanks so much for having me. The key here is low and slow. What I see so often is that people will start right back in where they were months or years ago and then wind up with an overuse injury of some kind. So, you know, find an exercise that you enjoy and then start with a gradual progression of that exercise. A tip that I give to runners that I treat is to not increase their mileage more than 20% over a 2-week period. And if you're going to start something like a resistance or a strength training program, make sure that you're focusing on high repetition, low load with some of those stabilizing muscles in addition to those power muscles like your quadriceps and your hamstring, so that you're not winding up with a muscle imbalance.
So for women specifically, what's a key area that women of any age can focus on?
So women, we tend to have wider pelvic angles and increased ligament laxity, which predisposes us to more injuries at the knees and the ankles. So one way that we can kind of counteract this is by strengthening the outer hip muscles called our gluteus medius and minimus. Basically what these are is our pelvic stabilizers. So they're preventing excessive rotation at the knee and the ankle and can help reduce a lot of injury risk if we can get stable from here working down the chain.
All right, can you show us a couple of moves that we can practice at home?
Sure. So I'm going to keep everybody on their feet today when we're doing exercises. All you really need to strengthen these muscles, because they're small, is just a simple resistance band. You can get them on Amazon, Walmart. They sell them everywhere. We're going to put this around the knee today. So the height at which you put the band makes it more difficult. So if it's down at the feet, it's going to be harder than at the knees. And obviously the resistance of the band makes it more difficult. What we're going to do first is what's called the band walk. So we're going to do what we call a pelvic tilt. We're going to tuck that pelvis under so we engage our core. And then we're going to take small steps in a straight line, keeping the knees and toes in line with each other and not waddling the trunk. You can do this any length of a hallway that you have at home or at the gym. And the longer you go, obviously, the more endurance you're going to add to these muscles here. Now, if we want to work more in like a single leg stance position, you can leave that band at the knees and put your foot either on a chair or on a wall that you have at home. So you don't need to get a ton of equipment. You're going to keep the knees lined over the toes here. You're going to tuck that pelvis under again so that you can engage that core. That's really important here. And then without turning my trunk to the side or leaning, or rotating my knee inward, I'm going to rotate my left knee out to the side and back. This is going to work my glute muscle that I'm standing on, in addition to the one that's also rotating out to the side, so that I'm working that stability on my single leg, so that if I'm doing something like a single leg squat or running or jumping, I'm building that stability in that muscle itself.
Allie, thank you so much. Good stuff, good tips this morning.
No problem. Thank you.
Yeah, so Dr. Vopad, anything you can add to what Allie was demonstrating for us this morning?
I would just say that women and girls need to not be afraid to lift heavy. And by heavy, I mean pushing themselves to whatever feels hard to them. That's the way that our muscles adapt, and that's how we gain muscle and we gain strength. So again, I think too many times we're afraid to sort of push the limit, but we do need to keep trying to push so that we get the proper adaptations and strength and progressions.
So we talked about calorie intake. Let's talk about nutrient intake? Because there's a lot talk about more protein, less fat, carbs. I was thinking this morning, I remember back in the day when you just would eat a bunch of bagels to try to lose weight, all this carb and sugar, and then it goes back to now you got to have all protein and no carbs, and it's like I'm so confused. So lay it out for us. What do we need?
Yeah, I think it's a balance of actually all of your macronutrients first, right? We want to, number one, there's this pyramid called the hierarchy of nutritional needs. So for female athletes, the baseline is getting your total amount of energy in. Then we move on to the macronutrients. Are you getting adequate levels of protein, which will keep you full throughout the day and allow you to build muscle? If you're doing a lot of high-level activity, you need to add on carbs, because carbs is your immediate energy source for exercise activity. And then we go into micronutrients thereafter, things like making sure that we're getting enough vitamin levels in, vitamin D, ferritin, your iron sources.
Okay, those are the things we need. Okay, I'm going to ask you put you on the spot. What is the one thing, and you can't say soda or sugar or candy. We know that's bad, but is there anything we really should avoid?
I am not in favor of energy drinks.
Okay.
I think oftentimes they are marketed to be this magic thing that is going to improve performance or cognition or whatever, and supplements and things like that do live in an unregulated world, and oftentimes I have a lot of question marks about the actual efficacy of them, as well as the safety of them as well. As we know, there's a pretty large amount of caffeine in a lot of energy drinks, and particularly in youth athletes and things like that. That's not something that I'm typically in favor of.
No room for question marks, and there's a lot of good stuff out there. What do you think? What's your no-no?
I would say the overemphasis on focusing too much on supplements before you've actually perfected sort of the foundation of nutrition. So many people comes in, well, what should I take for this? Should I take this supplement? Should I take that one? And we got to bring it back to the basics to say, well, what are you eating for breakfast, lunch, and dinner first?
So it's not a replacement. You're saying it's supplementing what you're already doing that's meeting that baseline. It's not.
Right.
It's not. What are you missing? So how can I take a supplement to make up for that?
Right.
So walk us through a meal plan. What should that look like?
Yeah, I think kind of everything that we touched on, it's a balance of all of the things, right? And first and foremost, focusing on making sure that that athlete is fueling their body so that they have adequate energy availability, they have enough calories to fuel their performance, fuel all of their activity, as well as having plenty left over to fuel essentially their resting metabolic rate, keeping their heart beating efficiently, keeping their GI system working appropriately, all of those things that we need to live, right? And doing so can be a science and an art, and all in the same breath, making sure that that athlete has a balance of what their body needs. There's a research study that I looked at not too long ago, and it said that female athletes were estimated to underconsume carbohydrates 45 to 95% of them, which is a wide range, but I think is indicative of still the continued education that we need on the importance of carbohydrates, not only for performance, but also for female health. We know that carbohydrates play a role in muscle mass retention. We store carbs in our muscles. We know that carbohydrates play a role in actually helping our body absorb and utilize iron, which is probably a lesser known fact. We also know that it's important for hormone regulation, bone health, all of those things that I think we forget are also a part of how we fuel our body as well.
What's one food item that's always on your plate every day?
I'm a big fan of rice.
Okay.
Carbohydrate-wise, I think that it's easy to prepare, and I also love seasonings, and I can kind of vary my palate by whatever I'm interested in having for
And
that
keeping
meal.
sodium low. What about you, Dr. Vopat? What is a must-have?
I'm a protein girl, so some sort of meat in any capacity, honestly.
You were giving me some good tips before the show. I'm going to write. I was getting my free medical advice from you this morning. All right, if you have questions, I'm sure you do, send those in on the chat on YouTube or Facebook. You can go to the X platform, or you can email the Medical News Network. That information is right there on your screen. While you send in your questions, we'll get a quick check on the COVID count for the week. There are currently 8 active inpatients at the health system as of Monday, and that includes 1 person in the ICU and on a ventilator. We're happy to be in single digits, and we do expect to hopefully keep those numbers dropping as we get closer to summer. So let's get to some of the questions from our viewers today. And Ruth Ellen wants to know, how long does that test take?
Oh, that's a good question. We schedule the appointment for an hour. You're actually only under the hood for about 15 minutes minimum. I have had people that just get a little bit anxious or very aware that their breath rate's being monitored, so I may take them as long as 30 minutes under the hood. And then there's also a 15-minute just kind of rest period beforehand to get you in as rested of a state as possible. So 45 minutes probably maximum.
So help apply this test and what we're seeing here on the screen to the average aging woman. We're all aging, so we're all losing, muscle mass and wanting to keep the protein and keep things going. So for someone who isn't a young athlete, somebody who's maybe like myself, how can this test be applied to them, and what can they learn from it?
Yeah, it gives us that individual twist on how we intervene nutritionally for really anyone, but also the population that you're describing. As we have talked about, I do think that especially the aging woman who is active definitely tends to underestimate how much fuel their body needs. And so I think this can be a way just to understand and almost give permission to, hey, no, you need fuel throughout the day. Don't feel guilty or shameful about feeding yourself 3 meals, snacks, right? All of the things that we need to age appropriately to keep us strong, to keep our muscle mass there. We first and foremost need calories to be able to maintain muscle mass, and then breaking down where those calories come from protein and things like that is also important. So it can help us be individualized, and it can also help us just understand what's going on with our body and how we best approach that.
What is the most common nutrient deficiency in women?
Oh, that's a good question. I'm going to put a spin on this answer. I'm going to say carbohydrates. I feel like people probably think I was going to say like a micronutrient. We do see a lot of iron deficiency. I believe it's estimated that around 15% of female athletes do experience iron deficiency at some point. But I think that statistic is glaring when it comes to the female athletes that underconsume carbohydrates, 45 to 95%. And I have to do a lot of education on truly getting in, 400 grams of carbohydrates or whatever it may be. And that's going to be dependent on activity level, goals, things like that. So I would say carbohydrates.
If you were watching yesterday, Dr. Vopat's a big soccer player. She played back in the day, not too far back in the day, but before, she did her other job, becoming a physician. But question for you is, do you have cheat days, and what do those look like?
Ooh, I don't believe in cheat days.
Okay, that's fair enough. And why don't you believe in
I
that?
don't, because all foods fit, and there's going to be circumstances where you're going to get benefit, not just from a nutritional sense, but from a family sense, right? Interacting with my family, going out with friends and being social, that has a huge benefit too, not just a nutritional value on food. So I don't really identify with having cheat days.
You don't call them a cheat day.
I think there's a time and a place, depending what the motivation is.
Yeah, should we take that word out of the
I think you
world?
should. I actually do counseling on utilizing strategic word choice, because I put it in an example of when you cheat on a test. What is that? That's bad, right?
It's bad.
And we're not being bad for engaging in things that are supportive of health by having foods that nourish your soul versus nourish your body.
Sure.
And I think that can go a long way if you kind of switch how you describe that. We're taking the power away from food, and we're gaining that power back from it.
Yeah, could you imagine a life where we don't eat birthday cake?
I know,
Right?
right?
So cheat on our birthdays? I mean, it's crazy. All right, let's get our takeaways today. Allie, I'm going to start with you. What do you want folks to know and take away from our talk today?
Get out there and be active. Don't be afraid to gradually load your muscles, but also don't forget about your glute meats.
Yeah, absolutely. And Allie, can anybody just come out to the Performance Center? Just pick up the phone and call, come on out?
Yeah, you can call and get scheduled. We have personal training here. There's also some classes, and if you're in need of physical therapy, we have that here too. So
awesome. Thanks so much. Sarah, what's the big takeaway?
I think we talked a lot about educating yourself on what your specific body needs and not placing too much emphasis on one thing versus the other. There are certainly things that as a female athlete, since that's sort of what our program focuses on, needs to pay attention to, but don't just start incorporating what you hear on a Netflix documentary or off the internet. I would encourage everyone, of course, to meet with a sports dietitian. They can come see me for free at the Sports Performance Center. And as a reminder, you don't have to identify as an athlete. Anyone that does activity on purpose, just to get kind of another pair of eyes on what you're doing. Is this helpful? Are you overemphasizing too many things, or are there areas of improvement?
Does all the misinformation swirling around out there make your job harder when you talk about Netflix documentaries and people do the deep dive into the internet and then they come to you and they don't know what to believe?
I like it. I actually like being a little bit of a source of reason for people. Yeah. I feel like I get a lot of people that can kind of just, after our session, just kind of relax and be like, okay, it's not all of the confusion that it's kind of cracked up to be. There are small things that I can do that aren't overwhelming and that are realistic for me.
Dr. Vopat, there's like a simplicity to it, right? You don't have to be...
Yeah, it doesn't have to be complicated.
Right?
Yeah.
Right.
I think we just, have to go back to the basics and remember that you sort of are what you eat, right? If you gotta mesh that with what your goals are. If you want to gain muscle, you gotta make sure you have adequate levels of protein in there. And you gotta make sure if you want want to feel good with exercise, you got to give your body the fuel source, the glucose and the carbohydrates to feel good with that exercise. So just, bring it back, making it more simple and not as complicated.
And you're going to be back Friday because we're talking about KC Current. How exciting is that?
I know, it's so fun.
And what's it been like for you just in these first few weeks to be involved with this amazing women's soccer team?
It's just a wonderful environment. I think the goals of the KC Current and the goals of our program align perfectly. And then just to be part of that and in the atmosphere and in the stadium, the world's only, female athlete, purpose-built stadium is just amazing.
Such a cool time. All right, ladies, thank you so much. Thanks to our guests. Thanks to our viewers for being with us today. We'll see you back here tomorrow. Taking a dip for Alzheimer's research. How can hot tubs help your brain health? I'm Jessica Lovell on the next Open Mics with Dr. Stites. We show you the science of a study that sounds too good to be true. What scientists are measuring while participants are soaking. Wednesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.